So really quick, back to the anatomy, and then we'll get into a little bit more of the treatment algorithm. But here's a clean-cut shot of the pancreas organ, and you can see its close relationship to the blue and the red. That's a vein and an artery. In front of it is this tube here, which is the intestine. So tumors can arise. Oh, I guess I wanted to point out the different anatomy here: the gallbladder, the small intestine, and then the four different parts of the pancreas. There's the pancreatic head, the pancreatic neck, pancreatic body, and the pancreatic tail. Most pancreatic tumors develop in the head or neck, about 60 to 70%. Some develop in the body or the tail. And when we have the opportunity to cure pancreatic cancer, it's because of a surgery called a Whipple procedure. That is a very invasive procedure where the head of the pancreas, the small intestine, the gallbladder is all removed to take the tumor out and kind of Humpty Dumpty put you back together. Now, I'm not a surgeon, so I will not at all speak to the surgical technique here as a medical oncologist, but that's one of the procedures we do to get rid of pancreatic cancer tumors. There's another surgery if the tumor is more distal or in the tail, and that's called a distal pancreatectomy that can be done. Why is the anatomy important? It's important because when we stage these cancers, we want to know whether the tumor can be removed. Is it a resectable tumor or is it not resectable? Resectable means that the tumor is here. It doesn't involve any of these blood vessels, the artery or the vein. Borderline resectable is that the tumor is kind of wrapped a little bit around one of the arteries or the veins, has some contact with it, not encased by it. Then we have locally advanced disease. And I know these pictures are a little bit complex, but what we're trying to show is the relationship of the tumor to the blood vessels on the previous slide. Now, if the tumor wraps all the way around this artery or the peripancreatic veins, it's really not safe to do a surgery because at the time of the operation, a lot of blood loss could happen. Metastatic disease, or stage 4 pancreatic cancer, is when the cancer spreads from the original site, the pancreas, to a different organ. So this is just another view of the anatomy, and really quick, I wanted to point out the prognosis and why it's so important that we have discussions like these, because overall, the 5-year relative survival, if you have a diagnosis of pancreatic cancer, is truly not the best. You can see we have a lot of work to do. About 13% of patients make it to the 5-year mark when they're diagnosed, but it also is relative depending on where the tumor is. If it's localized, about 44% of the patients are alive at the 5-year mark. Regional, meaning there's some lymph nodes that are involved, about 16%. And if there's metastatic disease, the prognosis is a little bit poorer in that less than 5% of patients are still living 5 years out when the disease is spread on diagnosis.